To health matters now. Medical personnel working in government hospitals across Osun State have been urged to exhibit good attitude and treat patients with utmost respect. The State Commissioner for Health, Rafiu Isamotu, and the Executive Secretary of the State Health Insurance Scheme, Dr. Niyi Oginni, were speaking at an event in Osogbo. Rafiu Hamid reports.
It's the second quarter presentation of quality improvement tools to Osun State Health Insurance Agency government accredited hospitals and infrastructure support to the Ministry of Human Resources and Capacity Building. The essence is to improve on health care being rendered and to also motivate health personnel. But the attitude of some of the medical personnel to patients seems to be a major concern to stakeholders.
There's no reason for any patient to wait for 6 hours. And we do have, scenarios like that patients have to wait for that long. Please, let us do our best to ensure that we coordinate ourselves. The few staff that are around, we must work. Some of us will prefer to go to our private facilities first before we go to hospitals. That is not right.
I want to appreciate the fact that you allow your attitude in the various health facilities to determine the altitude of our health delivery in the state.
The Executive Secretary of the agency, Niyi Oginni, speaks on the modalities for the distribution of the quality improvement materials.
Requests are scrutinized and procurement is done based on items jointly agreed on by the management of both institutions. OSHI's Drug Distribution Center, set up 3 years ago, has been meeting the need of the accredited facilities for provision of essential medicines and consumables, thus reducing the syndrome of out of stock to the barest minimum in our accredited government hospitals.
The State Head of Service, Oyebade Oluboyega, appreciates medical personnel who have decided to stay in Nigeria, particularly Osun State, to practice their profession despite all odds.
In the last 6 years, Nigeria has lost about 4,600 medical officers to Britain alone. 4,600 in 6 years. And just yesterday, it was reported on the net that about 937 medical officers qualified again in England to practice medicine there. That is the misfortune of our country. We are trained for others to inherit. Instead of a satellite or flight to go to space, it is going down the drain.
The quality improvement tools for another quarter will be presented before the end of the year. Rafiu Hamid, TVC News, Osogbo.